Hey everyone, it's Dr. Marcon. This is part 3 of chapter 25 on the reproductive system. This part will cover fertilization, pregnancy, as well as some of the disorders of the reproductive system. So we talked about a little bit about fertilization, how the different reactions that occur once the sperm has joined with the egg, and now we have fertilization. So we have the zygote, we have chromosomes for both mom and dad, and then you can see on this slide that there is the presence of polar bodies. So about day 6 after fertilization, after conception, we call the cell a blastocyst. So the blastocyst will begin implantation. Blastocyst will consist of an inner cell mass and outer trophoblast. Now the trophoblast will form 2 layers. There's the inner layer, which is the cytotrophoblast, and then there's the outer layer, which is the syncytiotrophoblast. So here we see the blastocyst and the different layers of cells. Here's the blastocyst cavity. Here's that inner cell mass. We have the trophoblast layer here. And then we can, once implantation has occurred, we'll have 2 layers. We have the cytotrophoblast and then the syncytiotrophoblast. So the inner cell will actually become the future embryo, and this is the layer of the endometrium where the blastocyst has implanted. This just shows you how the placenta starts to form, and we can see that around 6th or 7th day of fertilization, the blastocyst will implant into the endometrium, forming those different layers. We can see that the syncytiotrophoblast is starting to erode the endometrium. By day 12, implantation will be complete. The extra embryonic mesoderm is forming, a discrete layer beneath the cytotrophoblast. And then by day 16, the cytotrophoblast and the mesoderm have become the chorion, and chorionic villi are starting to elaborate. We see that the body stalk of the embryo forms the basis of the umbilical cord. By 4.5 weeks, the embryo, we can see here, and we can also see the different layers starting to form the placenta, giving blood supply and food supply to the developing embryo. So we have the deciduocapillaris and deciduobasalis being well formed. The chorionic villi will lie in blood-filled intervillous spaces within the endometrium, and the embryo is now receiving its nutrition via the umbilical vessels that will connect it to the placenta via the umbilical cord. And here at 13 weeks, we see our fetus. We can see the placenta right here. You can see the chorionic villi, and then all these structures giving, nutrients and blood supply to the developing fetus. Formation of the placenta is completed during month 2 and 3. Before that, so we have the extra embryonic layers and the trophoblast layers becoming the chorion, with finger-like projections called the chorionic villi. Now, the chorionic villi nearest the umbilical cord will grow, and will grow in complexity. The part of the mother's endometrium adjacent to the chorionic villi and umbilical cord is called the decidua basalis. So here is the umbilical cord, here's the chorionic villi, and the endometrium closest to those structures is called the decidua basalis. Now, the endometrium opposite this, on the side where the lumen of the uterus is, the implanted embryo, so the endometrium opposite this on the uterine lumen side of the implanted embryo is the decidua capsularis. So the decidua capsularis is what will expand to accommodate the growing embryo. So after month 2, the embryo will be called a fetus and then will completely fill the uterine lumen by the start of month 4. So with regards to formation of the placenta, we both know that embryonic and maternal tissues will contribute to placenta formation. Here we see a 13-week fetus. So the decidua basalis and chorionic villi together make up a thick pancake-shaped disc at the end of the umbilical cord, and this is the placenta. And it's called the placenta by week 13. And the placenta will continue to nourish the fetus for 6 more months until delivery. With regards to the anatomy of the placenta, exchanges across the chorionic villi between maternal and fetal blood occur at this structure. So the placenta provides the fetus with nutrients and oxygen, disposes of its waste, and allow hormonal signals to be sent to the mother. And again, by week 13, the placenta is fully formed. So here we can see the structures that contribute to the placenta from both the mother's side and the fetal side. We have maternal arteries and veins, and then we have the umbilical arteries and veins where we have exchanges of nutrients, respiratory gases, hormones, and all this occurring within the placenta. So the placental barrier consists of all 3 layers of the chorionic villi. Sugars, fats, and oxygen will diffuse from the mother to the fetus, and then waste products such as urea and carbon dioxide will diffuse from the fetus to the mother. The syncytiotrophoblasts is a structure that secretes substances that will regulate the events of pregnancy. We have maternal antibodies that are transported across the placenta, so any immunity the mother might have will be transported to the fetus. Also, drugs or viruses, alcohol, and heroin can cross the placental barrier and have their effects on the developing fetus. That's why it's very important that the mother refrain from any alcohol or dangerous substances that could harm the baby, as well as certain drugs. We have pharmacological drugs that are considered teratogenic. Teratogenic meaning it could do harm to the fetus. Finally, we get to childbirth. Parturition occurs 266 days after fertilization, so about 9 months. We consider labor to be the events that expel the infant from the uterus. And here are the different stages of labor. The stages of labor and the length of labor will vary from patient to patient. Usually first-time mothers, the stages of labor are a little bit more prolonged versus someone, a mother who may have had, 2, 3, or 4 children. Usually the first pregnancy is the longest one. So with regards to the stages of labor, first stage, we have early dilation of the cervix. The baby's head will enter the pelvis, and the widest dimension is along the left-right axis. And then we have late dilation. Baby's head will rotate, so the widest dimension is in the AP or anterior-posterior axis of the pelvic outlet, and dilation will be nearly complete. So usually complete dilation is about 10 centimeters across. So we have 10 centimeter dilation of the cervix. When the mother comes in and she says she is dilated, we do an internal exam to check to see how much her cervix is dilated. Usually anything below 4 centimeters dilated, we tell the mother to go for a walk. And then 4 centimeters above, we can admit the mother, and it also depends on whether or not this is her first pregnancy or, she's had previous pregnancies. And usually also take into consideration whether or not the amniotic fluid or the amniotic sac or bag of water has ruptured or not. So after full dilation, or close to full dilation, then we'll have the expulsion. So this is when the baby's head extends as it is delivered. So we have extension of the head, and the baby has been delivered. Finally, we'll have the placental stage. So after the baby is delivered, the placenta will detach and is removed. I've had to physically wait for the placental stage, and it is it's definitely a test of patience, because you do not want to have any placental fragments remaining within the uterus. Usually it involves still holding the part of the umbilical cord attached to the placenta and slowly allowing uterine contractions to allow for the afterbirth or the delivery of the placenta. And it comes out in this big, bloody, gelatinous glob that plops right out. So it's pretty interesting. So now we're going to get into the different reproductive pathologies. First, we'll talk about reproductive system cancer in males. There is testicular cancer, or cancer of the testes, which affects 1 of 50,000 males, and commonly from early stage spermatogenic cells. There was about a 50% increase from 1974 to 1990, and this was cured in about 95% of cases. Prostate cancer. It's a very slow-growing cancer and can arise from the peripheral glands of the prostate gland. Risk factors include a fatty diet as well as a genetic predisposition. Usually what happens is male patients will complain of having difficulty urinating because the enlargement of the prostate will kind of cut off the prostatic urethra, or the portion of the urethra within the prostate, and cause difficulty for urination. Other cancers, reproductive system cancers in females. Ovarian cancer arises from cells in the germinal epithelium. Ovarian cancer is actually does not have a very good diagnosis, and can be quite insidious. Endometrial cancer, this arises from the endometrium of the uterus. Cervical cancer, also slow growing, arises from the epithelium at the tip of the cervix, and is often caused by the HPV, or human papillomavirus. And usually an increase in the number of unprotected sex, as well as multiple partners, increases your chances for cervical cancer, as well as exposure to HPV. Now, fortunately, there is a vaccination against HPV, which is usually given to pediatric patients before they've started having any sexual contact. So vaccinations are always good. I believe it's called Gardasil. So again, this protects you from the HPV virus, as well as potential for cervical cancer. Breast cancer, second most common cause of cancer deaths in women. About 97% of cases occur in women over 50. Treatment usually involves first surgical removal of the mass, a lumpectomy. Then there's radiation therapy, can be administration of selected hormones, or chemotherapy. And here we see a mammogram. Basically, they flatten your breast and take images, an x-ray image of the breast tissue. It's definitely one of the more uncomfortable imaging techniques, but here we can see, a film of normal breasts, and then here we can actually see a mammogram with a malignancy in this picture. So really quick on embryonic development of the sex organs. So at 5 to 6 weeks, the embryo is sexually indifferent, meaning we do not know the sex of the embryo just yet. We have different ducts that will determine whether or not the embryo becomes a male or female. There are mesonephric ducts, which become the future male ducts, and the paramesonephric ducts, which will become the future female ducts. And depending on the hormones that are involved, one duct will end up developing more than the other. So we have the mesonephros and the mesonephric or Wolffian duct. Again, this duct becoming the male structures, and the paramesonephric or Mullerian duct becoming the female structures. So depending on what hormone is present, that will determine whether or not the embryo will become male or female. So the male embryo's sexual differentiation begins in week 7. The mesonephric duct will become the epididymis, the ductus deferens, as well as the ejaculatory duct. And then we have degeneration of the female paramesonephric or Mullerian ducts. So here in the 7 to 8 week male embryo, with the go-ahead from the hormones, the mesonephric ducts will start becoming the male structures, such as the ductus deferens, the epididymis, as well as the ejaculatory ducts. And then in the female fetus, we have degeneration of the mesonephric ducts, allowing for formation of the paramesonephric ducts, which will eventually become the uterus, the uterine tubes or fallopian tubes, and part of the vagina. So, sexual differentiation in female embryos will begin in week 8. The cortical portion of immature ovaries form the ovarian follicles. The paramesonephric duct will continue with its development and become the uterus, the fallopian or uterine tubes, and the superior part of vagina. And then we have degeneration of the mesonephric ducts. And here we can see the different structures that will develop from the development of the paramesonephric ducts. And here at birth, the structures that are present after the mesonephric ducts are allowed to continue to develop in the male embryo. Puberty, a rough time. Puberty is a period of life between the ages of 10 and 15. This is when reproductive organs grow to their adult size. Now, events of puberty occur in the same sequence in all individuals. However, at the age at which these events of puberty occur will vary from person to person. So, again, some people can start puberty as early as 10 or as late as 15. Puberty males will develop secondary sex characteristics. So we have the enlargement of the scrotum testes at about age 13, as well as the appearance of pubic, axillary, and facial hair. Lengthening of the vocal folds produces a deepening of the voice or a changing of the voice. And this isn't always a smooth transition. Usually you'll have some squeaking or cracking of the voice as this occurs. The musculoskeletal system increases in mass, and then we have sexual maturation. There will be a production of mature sperm in the semen. Female secondary sex characteristics also occur in puberty. For females, we have breast budding around the age of 11, and then we have menarche. Menarche is the first menstruation. Now, it is important when you are taking an OBGYN patient history, that you have to ask your patient when they started having menstruation. So you ask about menarche, at what age did you begin having your menstruation? This is important because we have to follow the gynecological history of the female patient. Other estrogen-induced secondary sex characteristics in females include an increase in subcutaneous fat, a widening and lightening of the bones of the pelvic girdle. So these basically to kind of accommodate our reproductive years should the patient want to have babies. Also, there's the appearance of axillary and pubic hair, and then an estrogen-induced growth spurt from the age of 12 to 17. Now, the female reproductive peak usually occurs in the late 20s. Around age 35, the rate of follicle degeneration increases, and then ovulation and menstruation will stop between the ages of 46 and 54. So the ovaries will stop secreting estrogen, and this is when we have menopause. So at birth, females only have a certain number of eggs, so they only have a certain time period that they can have babies. And once the ovaries stop secreting estrogen and ovulation ceases, this is when menopause occurs. So, and then reproductive organs as well as the breast begin to atrophy. So ladies, you need to use it or lose it. So that is the chapter on the reproductive system and the end of part 3.